All right, what is up, video audience, YouTube/Facebook? What's up, guys? This is a bonus question from my podcast. So I'm doing a new thing here where I'll do a bonus question that's only for video audience. This is episode 64 of the Hardcore Self-Help Podcast. I did 3 questions, a question and an answer for mental health, life-related questions, and this is a bonus one that I'm doing just for you guys. So if you want to check out the whole podcast, you can do so at duffthepsych.com/episode 64, or you can go to iTunes or Stitcher or any other podcast app and just look up the Hardcore Self-Help Podcast. So here is the bonus question. The question had some preamble, but then they write, can decades of intense psychodynamic therapy become undone despite having years of living recovered? I selfishly ask this as I'm watching a family member suffer the reemerging of destructive psychiatric symptoms after they were recovered for a long while. And I consider if my own restoring with intensive psychodynamic therapy is actually fragile at best. This is something that has been unnerving to witness. So I want to make sure that the life I recover from all my therapy work is shored up and made able to be a lifelong healing, because if it can be undone, that really scares me for my own self and any life that I rebuild. So let me just rephrase the question, because the person wrote in a way that's was a little bit hard for me to understand at first glance. So the person is asking, can intense therapy, in particular psychodynamic therapy, which I'll talk about more, can that be undone? And can that sort of unravel spontaneously over the years? They're worried, and they want to make sure that the work they put in through therapy can hold up over the test of time. So a really good question. Now, let me define a couple things here. So they talked about psychodynamic treatment. What is psychodynamic treatment? So psychodynamic treatment is treatment that's inspired by psychoanalysis, which was the old sort of primary method that Freud used. So really what it's talking about is psychodynamic therapy is all about relationships, all about learning about your past relationships and how they relate to your present. So oftentimes you're talking about your parents, you're talking about early caregivers, things like that, and understanding how you fell into relational patterns and how those play out now, where in your development you developed these different sort of difficulties, and maybe where you may have been stuck in terms of your progression across the timeline of developing throughout your life. Now, that's a type of treatment that I would call a depth-oriented treatment, meaning you're going deep, you're looking for the origins, it's insight-based, you're trying to figure out where the problems came from in the first place. So it's much less rooted in the present. What would be rooted in the present is something like CBT, so cognitive behavioral therapy, and that's more focused on thought patterns. So when I feel a certain way, what is the belief that I have? What is the assumption that I have that's driving that feeling? So when you have a situation and you filter it through your thoughts, through your beliefs, and then you have an emotional outcome. And it's understanding how to break those down, how to challenge your assumptions, and how to really stop shooting yourself in the foot in the same way. So that focuses on a lot of really here and now methods for trying to get better. Psychodynamic therapy is more focused on looking to the past to understand what's going on in the present. So, I'm not sure what approach the person that you were talking about in terms of the person that's been unraveling, that family member. I'm not sure what approach they had used in their therapy, what sort of interventions they have gotten. But in general, so what you've done, psychodynamic therapy, is actually considered to be one of the therapies that's more resistant to relapse, so to symptoms coming back later on. And that's because it's a depth-oriented approach, like I mentioned. And what's been shown in research is that good psychodynamic therapy actually has a sort of upward curve where your improvement actually improves more after you end psychotherapy. So you increase in your gains over time, which is really unusual. And what they think that's because of that depth, is because of that insight. Now, personally, I like to combine the two. So I like to have action from the CBT and other sort of approaches that are based in solutions, that are based in the here and now, giving you strong coping skills to use, and then pairing that with insight, which is depth of understanding into the origins of how this came about. So what I think of it as the top level stuff, the action stuff, helps you to really cope in the moment. And then the insight into the underlying pieces, that helps you to protect yourself from it coming back later on. And so combined, that's a really powerful tool. So given that you've gone through intense psychodynamic treatment over time, I think that you're probably pretty okay in terms of that depth of change, that insight, and it not coming back spontaneously. But you got to realize that stressors, things that happen in life, big events, they can always throw you for a loop. They can always cause you to sort of regress back to where you were before you were in treatment or something like that. And that's normal. The thing that you got to realize is that you are resilient. You have to trust in your self-efficacy. Now, the difference between self-efficacy and self-esteem is that self-esteem is really feeling good about yourself, feeling like you're a good person, that you deserve things, blah, blah, blah. Self-efficacy is more about a trust in yourself, that you're not going to do everything right, that you're not the best person, blah, 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 but you are confident that you're going to be able to adapt. You know that you're adaptable. If something were to go bad, you've gone through something similar before and you can work your way out of it. So that's what I want you to really trust in, is your ability to draw on that self-efficacy, on that resilience, and say, even if I were to sort of unravel, if something bad were to happen and I were to regress a bit, or I were to have a hard time, I know that I've been able to make a recovery before, and there's no reason that I wouldn't be able to make a recovery again. And it's not like all that knowledge goes out the window. You didn't lose everything that you learned up to this point. You get to take that with you. It's sort of like, in video games, when you beat the game and then you start a new game with the same character, but it's a harder difficulty, but you have all that stuff that you brought with you from before. It's sort of like that. So you get kind of this like new +1 sort of deal, but you bring all of that knowledge with you, and it's not like starting from scratch. You have all that savings in there. So, don't be afraid of such an abstract thing. This is something that, sure, could it happen? Maybe. Is it something that you need to worry about? Definitely not. It seems like you put in a lot of work. It seems like you're a strong, resilient person. So I think that you're going to be in good shape, regardless of whether you have difficult circumstances or not later on in life. As to what's going on with this person, I couldn't say, because I don't know exactly what they've been through. Maybe they're just going through a really hard time temporarily, and that's what you're seeing them in, and it's really shocking. But again, the depth-oriented psychology, psychodynamic, other things like that, narrative therapy, things of that sort, those are going to be helpful in terms of the long-term gains. So I think you're in good hands, and I think you're in good shape. But thank you for asking that question. Now, to all of you guys out there, please go check out the rest of the episode. That was the bonus for you video watchers, but the whole episode is, again, at duffthepsych.com/episode 64. Thank you.